Hi, I'm Jennifer Kleinberg, and here's my audience. Only one nursing student could make it. Okay. Thank you all for gathering here. I was asked to speak with you all about diabetes so that you will know how to educate your diabetic patient when you graduate to become nurses. My name is Jennifer Kleinberg, and I'm a registered nurse. Currently work at St. Anthony's Hospital. Previously, I was an EMT. I worked on the ambulance for 4 years and also in the emergency room for 2 years. So, diabetes is a very popular disease, and you will see it often among your patients. According to the CDC, approximately 30 million people in the United States have diabetes. That is almost 10% of the population. My purpose here is to teach you what diabetes is, the signs and symptoms, and what are the treatments. In a normal person, to eat this chocolate bar, the pancreas will secrete insulin, a naturally occurring hormone in the body. The insulin then breaks down the glucose cell and then converts it into energy for the body to use. In a diabetic patient, however, their pancreas does not secrete the right amount of insulin. There are two different types of diabetes. Type 1 diabetes, most commonly found in children, is when the pancreas does not produce any amount of insulin. Now, type 2 diabetes, which is the one we usually see in adults, that is where the pancreas does produce insulin, but it is not enough to keep the blood sugar in the normal range. What is the normal range of blood sugar? The normal range of blood sugar is 70 to 110. Now, we want to keep the blood sugar within that normal range because outside of that, we run into a lot of other health problems. Circulation becomes bad. All the organs are affected by this abnormal, consistent, out of whack blood range. You get high blood pressure, renal or kidney disease. You get necrotic toes, where I've seen where people have their limbs amputated because they weren't compliant with their medication. So it's really important that you teach your patients to stay on top of their diabetes and check their sugar. Check 3-4 times a day. We have here the glucometer and testing supplies that diabetic patients commonly use. So what do we do when the blood sugar is outside of the normal range? So below 70 is what we call hypoglycemia, where the sugar is too low. Signs would be diaphoresis or sweating, tachycardia or elevated heart rate above 100, and if it's severe enough, the patient can go unconscious. So to treat that, we give the patient juice, carbohydrates, a sandwich to eat. We can treat with glucose gel, and if they are unconscious, we will give dextrose 50 IV push. So when the blood sugar is too high, above 150 is when we treat. We call that hyperglycemia. So it's important to let your patient know that no matter what medication they use, it's important to integrate diet and exercise, as this can be really beneficial and also lead to using less medication. Exercise will help to lower the blood sugar, and also a diet low in sugar and more complex carbohydrates like vegetables and whole grains. Other things we use for diabetic patients when their sugar is too high, of course, so the subcutaneous insulin, long-acting, short-acting, and intermediate-acting. And then we also have oral pills that we can give that help to stimulate the hormones within our body naturally. So there are different treatments there. So now you all know what diabetes is, and now you can educate your patients about what signs and symptoms to look out for and what treatments that are out there. Now you'll be able to treat your diabetic patients better. I hope you all learned a lot about diabetes. Thank you for your time.